Recording again whenever. Thank you. So welcome back. This is the hearing regarding Lift Pathways to Renewal LLC, docket number 22-32602-CON. We had most of the technical portion of the hearing this morning. We just finished up with OHS questions from the analysts, and now I have a couple questions that I want to ask of my own. But before I get into that, I did want to first, Dr. Bennett, I don't think I swore you in earlier. So I'm going to need you to raise your right hand, and let me make sure I have the prompt in front of me. That way I don't misstate it. Okay. Dr. Bennett, please raise your right hand. Thank you. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you have provided in your pre-file and the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Okay, thank you. I'm sorry to do that out of order, but I wanted to make sure I did it. And while I have you, I did just want to ask you one question, because there was a reference to sort of your connections and how those will help with the referrals that Lyft is expecting. I know your current position is with Connecticut Children's. Where are you located exactly?
Our clinic's in Farmington.
Okay. Do you have any other clinical privileges elsewhere in the state?
No, not currently.
Okay. Do you come down to this part of the state at all? I should say, first of all, I'm located in Fairfield. So I was going to ask it, do you come down to this part of the state at all, or do you primarily stay up in the Farmington area?
No, our only clinic is in the Farmington area, but we serve a population across the entire state of Connecticut, including Fairfield County.
Okay, so you feel confident, given your own experience, that despite the geographical difference, there still wouldn't be any concerns about referring patients to Lyft?
Correct, because we already do in their current practice frequently.
Okay. Thank you, doctor. I'm going to probably turn my attention back to Ms. Dobson now. Going to ask some questions about cost and financial feasibility, first of all. The first one I have is on page 10 of the application. It says Lyft has extra space in its office suite that can be repurposed. I'm just curious, what is that space currently being used for? And will whatever is in that space be relocated within the building?
So we have more space than we need in the building. We have the majority of the historic home, about a good percentage of the historic home. So we have offices that we're not using, and we plan to take on more offices in the building.
Okay. And if I recall correctly, it stated in the application that there was no capital expenditure expected. So I just wanted to clarify that repurposing those rooms, that won't involve any sort of significant use of funds. Is that correct?
Correct. When we the way that we saw the application as phrasing capital expenditure was machinery or instruments or expensive equipment and things like that. But the renovation of the downstairs is something that we actually plan to do anyway, and it's part of our plan.
Do you have firm plans in place for the renovation at this point?
No,
So you don't have any expectation as to what that might cost at right now?
well, the renovation of the upstairs cost about $20,000. I would imagine the renovation of the downstairs would cost the same, just painting and, updating the space. Perhaps some new furnishings.
Okay. And how would you expect to pay for that $20,000 to $40,000?
With our own funds.
Okay. Another question I had, so on page 43 of the application, you state that you plan to establish commercial provider agreements, but you cannot do so until you're accredited by the Joint Commission. I had never heard of that, and I was just curious what evidence you have that you can't establish commercial provider agreements until you're accredited by JCO.
Can I step in there, sir?
Sure.
Sorry, I work with a lot of national and local providers across the country. In some instances, you can go on network, but as a consultant and recommendation, your reimbursement rate will be much lower with anyone you contract with if you are not accredited by Joint Commission or CARF for another accrediting body. So,
And approximately, if you know, how long does JCO accreditation typically take for behavioral health services?
they like to see you treat 2 clients. So you apply while you're in your state licensure process, and you tell them that you're going through the process and you want to be accredited. Then you send them your state license once you get it. And then they generally want to see you admit and at least go through most of treatment with 2 clients. And that way they can see your chart notes, what type of treatment and therapy you're providing when they come out and do their site inspection before they then grant you accreditation. So generally, I would say 4 to 6 weeks after you get your state license is kind of typical.
Okay. And how quickly would you expect after that 4 to 6 weeks to be able to get these provider agreements established?
Provider agreements take a while. They're not quick on their end. They take anywhere from 30 days to a year, just depending on the provider and how quickly they're processing it.
Would Lyft be willing to, well, let me ask a different question first. Is there a way, once you've entered one provider agreement, to sort of revise it after you've received your JCO accreditation?
Yes, but I would say it's more of a hassle to do that than to just wait the 4 to 6 weeks and then go through the provider credentialing, because it goes back to that same timeline again to redo it.
Okay. Okay, I see what you're saying.
Yeah.
So these next questions, thank you for that clarification, by the way. These next questions that I have are regarding need and access. So Ms. Dobson, you testified earlier that you know through your own experiences that Center for Discovery Southport is going to be closing or probably closing.
That's what I've heard. Yes.
Do you happen to know why?
I believe it's due to staffing issues.
Okay. So my follow-up question to that was going to be, if they weren't successful, how do you know you're going to be successful in this venture that you're proposing? But if it's due to staffing issues, then it sounds like it's not a matter of getting people in the door. It's a matter of, other administrative issues.
Yeah.
So thank you for that. On page 30 of the application, you say that only one of the providers, Newport Academy, is offering adolescent PHP/IOP for depression and anxiety, and they cannot service the need of all the local communities. What do you base that statement on?
I'm fairly familiar with the various nationwide treatment centers and their philosophies, having been existed in the world of eating disorder treatment for a while. And Newport Academy is a primary, their primary focus is substance. And so our primary focus would be mood and anxiety and eating disorders. So it's a different population, focused population.
Okay. So you don't have any sort of usage data for Newport Academy specifically. I don't know why you would have that, because you're an entirely different provider, but I figured I would ask the question anyway.
Yeah, no.
Okay.
May I give anecdotal evidence? So I was the in-house head of strategy and development for both Newport Academy for several years, as well as Center for Discovery for several years prior. So I opened up those facilities for those groups. And I can tell you that the wait list for Newport Academy is extensive and multi-months long for both their residential and outpatient programs. And they do treat a slightly different clientele than what Mary's looking to treat. So.
Okay. Thank you. This ties into what we were just talking about. On page 32 of the application, it says that the waiting list to be enrolled in residential treatment in the tri-state area at the time of writing is such, on average, 6 weeks, that high-risk clients require step-up services from outpatient while awaiting a bed in RTC.
Correct.
So I was just wondering where that figure came from, the 6-week figure. Is that in writing somewhere?
One could get it in writing. We personally service clients. We would, as part of their care, call various treatment centers. And we also utilize a treatment placement consultant whose job it is to identify open beds throughout the country. And it was common knowledge that at the time of the writing of the application, there was a 6-week waiting list, which our patients personally experienced. And as a result, we had to send several patients all the way to California to receive residential treatment because of the lack of bed availability in this area. But if one were to ask a treatment consultant or a placement specialist, I'm sure that they would put that in writing for you.
It's been about 6 months since the application was filed. Do you happen to know if it's been about 6 months since the application was filed. Do you know if it's still on average about 6 weeks, the wait period?
I can't say that 6 weeks, 6 weeks is exactly where it is, because I didn't check this morning. And I, took an oath to speak what I know. So I can't say that for a fact, but if I were to verify it, we can put a late file in if you'd like for me to check.
Yeah, I would appreciate that. So I will take a note.
Yeah, I was putting a note that we would like to avoid any late files because we don't have any yet. So I wrote her a note that said, avoid late files. She looked down, she's like, oh, I'll give you a late file. Because honestly, the goal here is, and I was going to save this to the end, but I'll just say it very quickly, is we do want to get this done as fast as we can. You've seen numbers where we've already included 2023, financials, and I talked to the consultant about this, and I told them about the timeframes for approval with the agency, especially, in the past couple of years. So we're looking to fast track the best we can. And so far, I was really excited that we didn't have any late files yet. So I'm going to ask the agency to consider whether we can get away with her testimony about it being experiential without a late file. Or maybe get to the end and see if there's anything else you need.
When we were offline, there were a couple other things that came up. That being said, I don't think it's anything that'll take a very long time for you to cobble together. I think, maybe a few days. But I do understand your interest in moving this forward. But we will sort of get to those towards the end of my questions. And it sounds like Ms. Dobson can probably get this information relatively quickly. It sounds like she said just now that she can check something. I'm not sure what the something is that she would check.
It was with others. See, the problem is, I think she referenced that there are some type of specialists. What would you call them?
Well, back in November, we were utilizing a treatment specialist who does placements for beds in the country. We don't currently utilize her anymore because she went back to school to become a therapist. And so she's no longer doing what she used to do. But that was the person that I would generally call to get assistance with placing people in beds.
Yeah, I think she was contemplating going back to this person or perhaps another similar type of person, which means we're relying on some other person to say, yes, this is still my experience.
Okay, so it's not
Can I jump in?
Sure.
I mean,
Yeah, so in my experience, when my colleagues and I are trying to get a patient into residential treatment, either from my outpatient clinic or from patients admitted medically to Connecticut Children's, I would say the wait more recently has been 2 to 3 months. That's for adolescents. So for under 18, I don't have any updated information in terms of the 18 plus for residential treatment, but so 6 weeks I would say is actually pretty good. In my experience, it's actually been a little bit longer for residential treatment.
yeah, and just for point of clarification, 6 weeks is not an unusually long length of time for a residential bed. 6 weeks has been fairly standard. It was much longer during COVID. 6 weeks is not a bad number. It's not good when you're the patient, but it's not an unusually high number.
Okay. I don't think we need a late file on that then, between what you're telling me and what Dr. Bennett is telling me. So we can move past that. I think your statements are enough.
Thank you.
My last question was just concerning something that was written in Exhibit I, which is the responses to the public hearing issues. On page 22, as part of LIFT's long-term strategic plan, it states that in winter, spring of 2024, it plans to track cities of admission for clientele and determine if there is a need for additional sites outside of Fairfield. I was just wondering where that reference to Fairfield came from.
Well, I was born and raised in Fairfield, and I live in Easton with my family. We operate out of Westport, so I would imagine that when we wrote Fairfield, we were sort of thinking Fairfield County, Fairfield as sort of the epicenter of our lives. So looking at additional towns where there might be a benefit for this kind of service in Connecticut. you know, would be something that would be wise to do, I think, around that time, but not Fairfield, because we would have a Westport facility, so Fairfield wouldn't be a logical choice for a second facility. If I were to think about a smart choice for a second facility, it would probably be fairly far from the Westport facility.
Okay.
Yeah, and to clarify, I mean, I read that as they would start tracking where their patients are coming from. One of the things that I think you'll see in the other data is that given the specialized services and the extraordinary need, there may be an expectation that people might come from all over Connecticut. And
Right.
so this, my understanding of this is that they're going to start tracking, not necessarily that they're going to do anything with that, but it is something that I think they want to take note of in terms of, okay, where are the patients coming from?
Okay.
Yeah, we do have patients that come from a pretty wide catch pool in Connecticut at our current program.
So Attorney Rose, but that concludes my questions. I do want to discuss possible late files, but Attorney Rose, before we did that, I did want to give you an opportunity to do any follow-up with your client if you wanted to do that.
You mean closing remarks or?
Just I guess sort of like redirect with your own client on any of the questions that were asked by OHS. If you wanted to clarify anything further, I feel like you sort of jumped in where you felt you had to, but if there were additional questions that you wanted to ask, I wanted to give you an opportunity to ask those at this point.
Yeah, I really appreciate that. And the way that the proceeding unfolded, I think, the questions that were asked and the answers that were given, hopefully will give the agency the information that you guys need, which is absolutely what I'm focused on, is getting you, because I'll be candid, I've noticed that most of the applications have been resolved through agreed settlements. And in those agreed settlements, there's recitations of, this statutory criteria is met, not applicable. And so I wanted to make sure that whatever we did today, we would give the agency the information necessary to do the is met. And then we could very quickly, hopefully, come to any conditions that you felt were necessary that are consistent with what we've seen recently. Because again, I'm just cutting to the quick, because if that's going to result in an expedited resolution of the application, because I understand a final decision takes much more time to draft, and they're typically longer, more exhaustive documents. Certainly, we would accept a quick final decision that is an approval of our application. But I did want to make sure that since we have this opportunity to collectively row in the same direction and have a broad discussion amongst us, I wanted you to have the right information in front of you to, in good faith, say that all the criteria has been met. And I wanted you also to sort of plug with us, which I think you already have when you touched upon the Medicaid population and you talked about the difference between enrollment and actually accepting Medicaid patients in the US, whether there's a certain percentage and that type of thing. So I think you've already touched upon things that I would have expected you to, but I do want to again reiterate that our goal would be to come out of this proceeding to get an approval one way or another as quickly as we can so they could start putting the pieces in place.
Thank you. And trust me when I say it's our goal to move things forward as quickly as possible too, but it's not always possible. So with that, I did want to just bring up a couple late files that I think the analysts would prefer to have. And feel free to jump in, Annie, or not Annie, I apologize, Yadira, Jess, with any comments you may have. But I think you were looking at either, so you're looking at a charity care policy for the existing Lyft Wellness Group, as well as the new group. Is that correct?
Yes.
So I guess two different charity care policies, if there are two different ones, or if it's just one charity care policy that would apply across both, then a hard copy of that policy.
We can turn that around very quickly.
So,
Okay. And I think the other one that was mentioned was some sort of document or data that substantiates the access you have provided to charity care over the past, few years at Lyft Wellness Group.
so that's the 2 per quarter.
Without patient identifying information, obviously. Ms. Rival, Ms. McLaughlin, was there anything else that you had mentioned?
No.
No,
Okay. So that second one, Attorney Rose, is that something your client would be able to provide?
Yeah, do you mind if I take a break? Just a quick confer. I'm just gonna shut off the camera and the mute and make sure that, get an idea of what we might be able to present, just to make sure we have clarity. But because
Sure.
I'm interested in what we have. And then, so I'll pop back on in a second. Is that okay?
Yeah, that's fine. And also discuss how long you think you might need in order to turn those two items
Yeah.
around to us.
Yep, absolutely. So I expect to be back on in 2 minutes.
Okay, so I'm going to say we can stop the recording. Actually, is it okay, Attorney Rose, if we keep the recording going?
Yeah, I think that's
Okay.
fine.
And then you can just come back whenever you're
If I
ready.
fail to unmute though, please tell me.
Okay. All right, so this is just a reminder to everyone else that anything you happen to say or do will be it'll be recorded for the next 2 minutes or until whenever Attorney Rose and his client comes back. So